Hi, I'm Dr. Jason Wagner from Sarasota Vascular Specialists, and this is another Whiteboard Wednesday. So today we're going to talk about the causes for leg swelling. You know, it's not just something that just happens with everybody with old age. There are many different things that can cause you to have leg swelling. There are what we call central causes that affect both legs. So that could be, congestive heart failure. That could be volume overload, meaning too much fluid on board. And that's going to kind of make you kind of boggy and swollen everywhere. That's going to affect both legs equally. Additionally, certain medications like amlodipine or Norvasc can cause leg swelling to happen as well. And that's a common side effect of that medication. So if you just all of a sudden develop leg swelling and you've had a couple of medication changes, first thing you want to do is check and see if one of the new medications might have that as a listed side effect. The other things that can cause leg swelling, particularly if it's just one leg and not both legs, we start thinking of either outflow problems, meaning blood can't get out of the leg. So that could be a blood clot in one of the veins, like DVT or deep vein thrombosis, or it could be an outflow obstruction or compression. So in my diagram, I have two legs. I have a happy skinny leg and I have a swollen, bogged down, cartoon leg. And so here, if blood's trying to come out of the vein, remember, blood's trying to go from our feet up to our heart with our vein outflow. If it's being blocked up in the pelvis by one of the veins that is being compressed by other structures in the pelvis, it's called May-Thurner syndrome. That can cause a blockage higher up. Sometimes that causes a DVT or a blood clot to form in the iliac veins in the pelvis or in the thigh. And that we have to treat surgically or with a procedure, invasive procedure to get the clot out and to open up that narrowing with a balloon and a stent. The other thing, kind of the most common thing that's a cause for vein-related leg swelling is going to be called venous insufficiency. And that's where the veins themselves aren't doing a good job of getting blood out of a leg and keeping it out of the leg. If you elevate your legs and you're laying flat in bed and you put your legs higher than your heart, your leg swelling should theoretically go away overnight. If, however, during the day, as you're up and around and doing things, your legs progressively swell every day and swelling then has to elevate your legs overnight to get rid of it, that's probably a good sign that you have some form of venous insufficiency. And by that, I mean the one-way valves in our veins aren't doing a good job of preventing the backflow of blood. These one-way valves that should be letting blood go up to the heart, as it settles back with gravity, they should snap shut. If that's not happening, you get this backwards pressure of vein fluid, of blood, down from the big veins to the smaller veins to the smallest veins. And as that's happening, that pressure, that fluid is being pushed out into the tissues. And so as the fluid, which is really just the plasma of the blood, starts getting into the tissues, that causes the tissues to swell, that exerts a pressure. That outward pressure to a multiple is tension on the outside of the leg. So some people will complain of itchiness, heaviness, pain in their swollen legs. Well, we have these nerve endings that are in our skin. They're called cutaneous nerves. And that outward pressure creates a lot of tension. And that circumferential tension puts those nerves under a lot of stretch and a lot of strain. Some people get a sensation of itching. Some people get a sensation of burning. Some people get a sense of just kind of heaviness, ache, or numbness. The way we help kind of undo that change is to compress the legs, put them in compression stockings, take the tension off the skin, and then figure out what the actual underlying cause is for the swelling. The way we do that usually is with ultrasound. It's non-invasive. We do it here in the office setting. It takes 45 minutes to an hour. And we look at the flow of the veins first to make sure that the deep veins, the ones by the muscles, and the superficial veins, the ones between the skin and the muscles, are all open and flowing correctly. If they are flowing correctly to get out, we then check and see if the valves are doing their job. If the valves aren't doing your job, then we figure out, okay, can we get rid of the bad acting veins, the ones that are not doing their job? If there are enough good veins doing the job, letting blood flow get out of the leg. If all the swelling is because of one bad acting vein, but the rest of the veins are all doing their job, we can get rid of that one bad acting vein, and then the leg swelling should hopefully completely go away. Obviously, we're going to use compression stockings as a first measure to control the swelling. But then from that point forward, if we need to, or if we can do a procedure, minimally invasive, you walk in and walk out of the office to fix it, we'll do that. In summary, when it comes to unilateral leg swelling, the things that we look for are a blood clot, an outflow blockage or compression, or bad acting vein valves that are letting venous insufficiency or letting blood go the wrong way. If you have any comments or questions, feel free to leave a comment below or reach out to us at sarasotavascular.com. Again, I'm Dr. Jason Wagner, and this is another Whiteboard Wednesday.